Now, for more on our health news today, let's bring in the Chief Scientific Officer for the wellness company, Dr. Peter McCullough. Dr. McCullough, thank you so much for joining us.
Thank you.
Well, Doctor, last week, 2 doctors from TWC testified before Ron Johnson's Senate Subcommittee on Investigations on the topic of COVID-19 and corruption of science. Talk to us about why hearings like this are so important and what was the kind of explosive testimony that you had there.
America saw this on full display. The biopharmaceutical complex and their state actors, and I would put Richard Blumenthal and Hawaii Governor Dr. Josh Green in the complex, they were essentially promoting a false narrative that the COVID-19 vaccines saved millions of lives. So therefore, the damage caused by the vaccines, including heart damage, myocarditis, and the lives lost due to the vaccines, was somehow worth it. And it's all wrong. Blumenthal said 1.2 million Americans died with COVID-19. Even the CDC data suggests, just half of those individuals actually had pneumonia as categorized in the National Center for Health Statistics data. And on top of that, there are no randomized trials showing the vaccines reduce lives, no valid observational studies, and all-cause mortality has gone up with the vaccines. So what we found is a cover-up. The government was covering up the fact that the vaccines were causing heart damage, fatal myocarditis.
So if we're seeing, Doctor, that some of the studies that you're talking about did not actually reduce deaths, but what you are seeing studies that show that there is a direct link between the vaccine and myocarditis and pericarditis, what do those statistics show? Is that more likely that the cure was worse than the disease?
The cure was definitely worse than the disease. The messenger RNA from Pfizer Moderna is found in the human heart, and its spike protein produced are found at the time of autopsy. These cases are fatal. I reviewed cases before the Senate, Beau, where the myocarditis is so fulminant that we can't save these young, healthy men in the hospital. That's how dangerous these vaccines are. So there have been untold numbers of lives lost due to the vaccine. The FDA still doesn't warn that myocarditis can be fatal on the package insert.
That's crazy. Well, Dr. McCullough, is there ever going to be a reckoning in the Senate about this? You mentioned Senator Blumenthal, who may be under the biopharmaceutical thumb. Are there other senators out there like this that people need to know about that are not doing their jobs? And will we ever have a proper reckoning about the effects of this?
When Blumenthal was giving his opening statements, it looked like some staffers brought in vaccine advertisements and poster boards, and they put them behind Blumenthal and Senator Maggie Hassan. So I think Blumenthal, Hassan, Bernie Sanders, a whole cadre of senators, and as well as those in Congress, are heavily influenced and are answering to the biopharmaceutical lobby. They're not looking out for Americans' best interest with respect to vaccine safety.
And where's Bobby Kennedy on all this? Will he have any sort of influence in being able to get to the bottom of this now that we have someone that actually cares about it?
Kennedy may be limited by, the confines, the metes and bounds of his job description, his reporting relationship. As an independent public figure, I'm far more free to tell America the truth honestly than RFK is.
Well, Doctor, just to change your thought process a little bit, over the last couple of weeks, we have been talking quite a bit about parasite infections here in the U.S. and how they can be treated. Why do you think that our healthcare agencies have completely dropped the ball when it comes to talking about the threat of parasite infections right here in the U.S.?
10 years ago, the CDC put out an informational piece about neglected parasite infections, that we neglect these common infections. So the most common is Giardia from drinking dirty water or stream water. The next is actually toxoplasmosis, which comes from cat feces and cat litter. And then the third is forms of pinworms and hookworms that we get from dirty toilet seats and rest stops and things like this. So everybody has to be on their guard. They're difficult to diagnose. See your doctor at the wellness company. We're expert in managing this, and we have an answer, and that's a combined product of ivermectin and benzoyl.
And just as a final thought, Doctor, I mentioned RFK earlier and Bobby Kennedy and what he's doing. Do you think he will have more influence over the effects of autism and the things that may lead to that in terms of where you see his direction going as HHS secretary? I think a lot of people are expecting big changes. And do you think that he can deliver on items like that?
He's recently walked back this September guideline for autism evaluation, but let me tell you, autism doesn't have a single cause. It's a complex neuropsychiatric disease. The children are not born with it. They develop it during these critical, stages of early development. There are risk factors, and the risk factors should be evaluated. One of them is intensive combination childhood vaccination, febrile seizures, and then neurologic damage.
Well, that's something to think about, and all the parents out there, I'm sure, including myself, will be paying attention to you. Well, Dr. McCullough, thank you so much today.
Thank you.